Welcome everyone. This is a talk on red light recovery therapies. I'm Dr. Eric Bunge, a chiropractic physician who specializes in physical medicine. In particular, red light therapies like a Class 4 laser, whole body beds like the TheraLight 360 and the ARRC LED, and home units like the Vielight intranasal unit we're going to explain in a little bit. Today in particular we're talking about improving athletic performance of all ages, student athlete to the retired senior. We all have troubles with oxidative stress, pain, and inflammation. Red light therapy is going to provide us faster repair, improved pain relief, a stronger recovery, improved strength gains and flexibility gains, improvements in our memory. Red light therapy is going to do this without contraindications or side effects. It's very comfortable and enjoyable, and it complements any routine that we might be doing now. Red light therapy is unique in that it improves mitochondrial dysfunction directly with this photon of light, and we're going to be looking at that here in just a second. This mitochondrial dysfunction is very important because it's the basis of not only injury or prolonged effects from having an injury, but the degeneration and degradation of our systems as we get older. The ability to make ATP is within each of our cells inside this mitochondria. It takes fuel and turns it into ATP. That ATP is what goes throughout our cells and fires up all the different, either it's repair or regeneration or rejuvenation, whatever that cell needs energy for, it has to come from a mitochondria, with the exception of red blood cells, and that's where the green comes into play. While we're improving this mitochondrial dysfunction, we're going to see an improvement in the nitric oxide dispersion. So now we're going to see increased blood perfusion. This is going to have a cascade of benefits, and one of which, the most important, is stronger, faster collagen building. When there's damage to nerves or when we're getting older, we want to see improved nerve connections being formed, in particular helping the glial cells which keep our nerves alive. We want the glial cells and nerve cells to have not only oxygen, but also this ATP energy available to them. We see with the Vielight perfusion and oxygen to the central nervous system, and that's going to be very important as supportive care for Alzheimer's, dementia, and Parkinson's, or for someone that's had a concussion or some sort of head trauma. And that's going to help prevent early apoptosis, such as Lewy body dementia and Parkinson's diseases. How it works is with specific wavelengths. Red and green are going to reach much shallower, maybe 1 to 2 centimeters. But these near infrared wavelengths, the 800s, the 900s, and even the 1064 near infrared, they're going to be able to reach much deeper. And you're going to see in these beds and in the devices how they help. Why don't we take a look at the actual mechanism here of mitochondrial respiration that's occurring. So the process is called PBM, or photobiomodulation, and if you look on PubMed or look into clinical research, you'll see a lot under photobiomodulation or low-level light therapy. There's tens of thousands of articles with just about every kind of tissue or structure we're trying to improve. You'll see some research done with it, all showing, again, benefits without side effects. This bed has 4 wavelengths. The ARRC LED adds a 528, and the reason for that is the green helps energize the red blood cells. All other cells within our body have this mitochondrial system to make energy. So with an ARRC LED adding the green, we hope to see an even greater improvement in athletic performance. However, I can, from my experience with the TheraLight being as powerful it is, we see plenty of results in just 10 minutes. These photons of light have a very small amount of energy. They're non-ionizing, they don't pose risk to DNA, creating cancer. But what they do is, as they travel through these tissues, unimpeded, water is a great example. What water does is it allows this photon of light to either travel through, or scatter slightly, or maybe be absorbed and create a little thermal effect. But for the most part, these red light therapy photons just travel through, and they reach a place where there's been stagnation. Their goal is to reach into the mitochondria, into the Krebs cycle, to the electron transport chain, to the CCO molecule, where we find that nitric oxide has bound to it. The photon of light has just enough energy that it dissociates the nitric oxide from the CCO molecule not only freeing up the nitric oxide to help with the vascular signaling within the cell and the other cells, but this now starts the ATP cycle operating more efficiently. So we have an increase in ATP immediately, and that night for repair, the system is fast forwarded. You can think of it as recharging your battery. And then the nitric oxide cascade helps with all vascular epithelium to help them repair themselves because they now have a signal for improved performance. As I said, it's pretty straightforward. First month we're going to be focusing on recovery. Second month we're going to be focusing on deeper repair such as muscles and joints. And then the third month for deeper regeneration. My clinical experience in the last 2 years with the TheraLight bed and since 2014 with the laser is that within this short amount of time you'll see the treatment goals met. Now the Vielight research with the cognitive wellness is showing that there does seem to be a benefit to continuing that, maybe not twice a day, but certainly over longer periods of time. So today we have a whole body bed, we have a laser, and we have home units like the Vielight or even the Joovv, and there might be other quality units out there. But rest assured, many people have bought units that they've spent well over $3,000 for, and they weren't quite up to par. They were simply red LEDs, just a few. This TheraLight has 45,000 LEDs. That's quite a big difference. This is one powerful 810 nanometer diode for the intranasal device. What we're looking at again is that the 528 and the 635 don't reach as far. And with diodes, there's a lot of scatter. Lasers are going to use a higher wavelengths, but we can also have higher wavelengths in the beds, the 800s and the 900s. And those wavelengths are going to reach at least 1 inch through the body. Let's see what it looks like with the bed. So you can see the red stripes, and that's a 635. But the 800s and the 900s, we can't see with the camera and the visible eye. And as I said, they're able to reach deeper, and they're able to get the penetrating benefit within many parts of our body. Just think about how 15% of the body weight is the skin, but how much is within 1 inch of that. So both the ARRC LED and the TheraLight beds converge all the diode output so that we get a much better penetration. There are many flat surfaces, bony surfaces, even muscle within that 1 centimeter to 1 inch of the skin. And the combination of all these wavelengths helps us achieve these results in just a few minutes. Lasers combine 800s and 900 wavelengths, sometimes at 635, because that's going to enable them to reach deep through muscle and skin, deep through even fascia, joints, to reach injured ligaments, to reach around the hip capsule, deep into shoulder blade trigger points like the subscapularis and teres major. Loosen up neck musculature and joints that are stuck. Help with low back pain, reaching deep not only through the quadratus lumborum and the paraspinal musculatures, but even around the ribs, freeing up things on the spot, just with a few minutes. We'll get into the treatment protocol here in a second. The Vielight uses an 810 wavelength, which is able to go through bone. You can see from its vector here, it's going through the cribriform pate into the ventral midbrain. This enables it to find and bathe all the areas, not only with direct, but with the scattered central nervous system areas that are important for motor control, for memory, posture like the thalamus, anxiety and depression and mood like the limbic system, the area of substantia nigra, possibly the pineal gland that helps with melatonin, the pituitary. With the laser, we can come from back and help with the cerebellum. The Vielight has a transcranial unit, so we're able to reach the outermost part of the brain, the cortex. All getting this response in just a few minutes. So now we have 2 beds. Both are Class 2 medical devices, so they don't need any clinical supervision necessarily, just good guidelines for use. We can use them 10 minutes a day. We can do it 2 to 5 times a week. We can have a very low power for someone that's not able to recover as quickly, such as fibromyalgia or diabetes, or we can go full power for tactical athletes or student athletes. Just 10 minutes a day, 2 to 5 times a week. The lasers, we can spot treat twice a week. I recommend at least 25,000 joules. There's at least 35,000 joules in a 20-minute session. With the laser, just 25 joules twice a week, we see the patient reporting significant improvement very quickly. And the Vielights now, we can use them at home for 25 minutes twice a day. So the benefit is mitochondrial dysfunction being improved and the making of ATP, the release of nitric oxide and the improvement of the vasculature, especially with epithelial inflammation. Collagen being built stronger and faster. You're going to see that in the skin, the muscle, even the fascia. Improvement in nerve connections and the glial cell health. Oxygen to the vital central nervous system areas. Prevention of early apoptosis, all simply with a bed, laser, and home units. I hope this answers some questions. I hope it sparks some others. And I do recommend everyone try to find a bed and get started, or at least a Vielight or a Joovv unit. I'm open to consultations, and I wish you all the best of luck, and we'll make more videos on how to use these red light recovery therapies more effectively. Thank you.